Hello and welcome. This video is dedicated to spread awareness on secondary immunodeficiency disorders. As the time moving fast and our populations grow, we meet different people and we share moments with them every day. The number of people with secondary immunodeficiency disorders also rises. But why? And how does these disorders spread worldwide? Are you curious? Let's find out. First, let us talk about what happens to your body when you have an immunodeficiency disorder. First, of course, when you have immunodeficiency disorder, this will affect your immune system and your body can no longer fight any bacteria or viruses and other diseases such as HIV, AIDS, and leukemia. We move on to what is secondary immunodeficiency disorder. Secondary immunodeficiency disorder, or what we also call acquired immunodeficiency disorder, is one of the major causes of infections in adults. These immunodeficiency disorders affect your immune system partially or as a whole, making your body an easy target for several diseases and infections. Secondary immunodeficiency disorder is more common than primary or congenital immunodeficiency disorders. In most cases, the treatment of primary immunodeficiency disorders are also used or can help manage the effects of secondary immunodeficiency disorders. So again, in comparison, primary immunodeficiency disorders are disorders that are hereditary or acquired through birth. And for our secondary immunodeficiency disorders or our acquired immunodeficiency disorder, these are disorders that are acquired through infections and lifestyle and also our diet. So to give you a more view on secondary immunodeficiency disorders, here are my group mates to report on some very common disorders that affects our immune system.
What does AIDS mean? AIDS stands for Acquired Immune Deficiency Syndrome. Acquired means you can get infected with it. Immune deficiency means weakness in the body system that fights diseases. Syndrome means a group of health problems that make up a disease. AIDS is caused by a virus called HIV, the human immunodeficiency virus. If you get infected with HIV, your body will try to fight the infection. It will make antibodies, special molecules, to fight HIV. A blood test for HIV looks for these antibodies. If you have them in your blood, it means that you have HIV infection. People who have the HIV antibodies are called HIV positive. Being HIV positive or having HIV disease, it's not the same as having AIDS. Means people are HIV positive but don't get sick for many years. As HIV disease continues, it slowly wears down the immune system. Viruses, parasites, fungi, and bacteria that usually don't cause any problems can make you very sick if your immune system is damaged. How do you get AIDS? If you are infected with HIV and later you might develop AIDS, you can get infected with HIV from anyone who's infected, even if they don't look sick and even they haven't tested HIV positive yet. The blood, vaginal fluid, semen, and breast milk of people infected with HIV has enough of the virus in it to infect other people. Most people get the HIV virus by having sex with infected person, sharing a needle with someone who's infected, being born when their mother is infected, or drinking the breast milk of an infected woman.
And now we're going to be talking about multiple myeloma. So, multiple myeloma is an incurable blood cancer that produces proteins that can cause damage to lots of organs, particularly the bones and the kidneys. Symptoms vary, but it can include fatigue, anemia, bone pain, and frequent infections. While it's not clear what causes multiple myeloma, doctors know that it begins with an abnormal plasma cell in your bone marrow, which produces too much protein inappropriately and multiplies rapidly. The disease almost always starts with a benign condition called monoclonal gammopathy of undetermined significance, or what we call MGUS, and MGUS is a pre-malignant condition. It's only found in blood, and it's where you find excess protein that's in the blood. And this is something that indicates that you have the potential to become a multiple myeloma patient. And finally, like with any other cancers, the disease can be treated with radiation, medications, chemotherapy, and even bone marrow transplant.
What is leukemia? So, leukemia is a cancer of the blood characterized by the rapid growth of abnormal blood cells. This uncontrolled growth takes place in your bone marrow, where most of your blood's body made. Leukemia cells are usually immature or still developing white blood cells. Unlike other concerns, leukemia doesn't generally form a mass or tumor that shows up in imaging tests such as X-rays or CT scans. These abnormal cells, called leukemia cells, begin to overtake the space inside your bone marrow. They crowd out the cells, trying to develop into healthy red blood cells, white blood cells, and platelets. So there are the four main types of leukemia: acute lymphocytic leukemia or the ALL, acute myelogenous leukemia or the AML, acute lymphocytic leukemia or the CLL, and acute myelogenous leukemia or the CML. For the ALL, acute lymphocytic leukemia, this is the common type of leukemia in children, teens, and young adults up to age 39. All can affect adults to any changes. Acute myelogenous leukemia or the AML is the most common type of acute leukemia in adults. It's more common in older adults, those over 65 years old. For chronic lymphocytic leukemia or the CLL, this is the most common chronic leukemia in adults, most common in people over 65 years old. Symptoms may not appear for several years with the CLL. For chronic myelogenous leukemia or the CML, this is more common in older adults, most common in people over 65 years old, but can affect adults of any ages. It rarely occurs in children. Symptoms may not appear for several years with the CML. Most common signs and symptoms of leukemia includes fatigue, tiring easily, fever or night sweats, frequent infections, shortness of breathing, pale skin, unexplained weight loss, bone or joint pain or tenderness, pain or full feeling under your ribs on the left side, swollen lymph nodes in your neck, underarm, groin or stomach, an enlarged spleen or liver, and the last is the bruising and bleeding easily, including nosebleeds, bleeding gums, a rash that looks like tiny red spots in skin or the petechiae, or purplish darkened skin patches.
Secondary immunodeficiency disorder, one of its disorder is myeloma, or also called as multiple myeloma. It is a cancer of the plasma cells. As we all know, plasma cells are white blood cells that make antibodies that protects us from infection. In myeloma, the cells grow too much, crowding out normal cells in the bone marrow that make red blood cells, platelet, and other white blood cells. Symptoms or manifestations of myeloma is CRAB, C for calcium elevated or hyperkalemia, R for renal failure, A for anemia, and B for bone lesions. To summarize all this up, we would just like to say from 3H-D1 that be careful out there, stay safe, and there is a lot more in life, and having these disorders are not part of it. So we hope that you learn from this video. That's all.